Can you talk just from your experience, what have you seen in terms of conditions that have improved for people by restoring gut health? What sort of conditions can be directly related that can be improved through that?
Well, as a gastroenterologist, I see a number of different diseases. Commonly, irritable bowel is one of the most common conditions that we see, and not only as a gastroenterologist, but even in general practice, an internist will see a lot of irritable bowel because it's so prevalent. 10 to 15% of our U.S. population has irritable bowel, and that is a model for a more holistic and integrative approach towards managing that disease.
And what is it exactly? Is it just an upset stomach, or what is specifically irritable bowel?
Well, that is, it's a broad term. There's defined criterion that have altered bowel movements and abdominal pain that have to occur with a finite frequency in order to meet that criterion for a long period of time, minimal 6 months, 3 months if you have consecutive symptoms. There's a Rome criterion that many of us use. There's a congress of doctors who have had 3 different meetings about how to define this. And so we use something called Rome criterion to diagnose an individual with irritable bowel and make sure it's nothing more serious. And so what we see is altered bowel movements and abdominal pain and discomfort, and they can have a really severe, adversely affected quality of life. And there, with basically altered lifestyle and diet, getting people on a clean diet, trying to rebalance gut bacteria, because some people have an overgrowth of bad bacteria, it's called small bowel overgrowth, where it's misplaced in a small bowel. Other people may respond to probiotics and just trying to get them on a good diet, because a lot of them are not on a good diet, is the first thing we try to do, and also some stress modification, because that's got a direct connection as well.